Well, good afternoon, everybody. This is Denise Wallagora, the Training and Delivery Specialist for Mental Health First Aid. Just want to thank everybody for taking time out of your very busy schedules to join us for a webinar today. So today we're going to be talking about mental health for death care professionals. There is a few housekeeping notes there on the right-hand side of your screen. If you could just please make sure that your phones and laptops are on mute. So that we don't get any background noise during the presentation today. And as it says, please save your questions for the end of the presentation. We will definitely give enough time for a presentation, and my colleagues are keeping a track of the list, a running list of questions, and that we will make sure that we answer them during the Q&A at the end. So so today you're going to be joined by myself, Denise, and by my colleague, Alyssa, Business Development Officer. So just to give a little overview of what we're going to be talking about today is I'm going to be talking about health and mental health. We're going to be addressing the mental health continuum. I'm going to talk about how we take a look at ourselves and where our mental health is on a day-to-day basis. I'm going to talk a bit about the two most common mental health problems that society faces today, which is depression and anxiety. We're going to talk about some signs and symptoms of both of those mental health problems. I'm going to touch on compassion fatigue. I'm going to just touch a little bit on the 5 basic actions of mental health first aid, spend a little bit of time on the importance of listening non-judgmentally, and I'm going to round out my presentation talking about the importance of self-care. Once I'm finished, then Alyssa's going to jump in, and Alyssa's going to talk to you about all the different training options that we do offer at the Commission through Mental Health First Aid and the Working Mind. So as we move along, let's take a look first at the definition of health. So when we take a look at how the World Health Organization defines health, we see that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And why it's important to take a look at that is that we know in our own lives, in our personal lives as well, we have people in our lives who may be living with a physical illness, so they may be living with diabetes or they may be living with heart disease, but they could be very fully involved in their treatment, which means that they are healthy because they are following along. So for example, somebody that's living with diabetes may be following the diet as they're supposed to be, taking whether it's the medication or whether it's the insulin, but following along what the treatment is by their doctor, and they could be seen as being healthy. So that's certainly important to think about that and to remember that as well when we talk about individuals as well living with mental health problems. Because just because somebody lives with a mental health problem does not mean that they are unwell. We could have individuals who are being treated for whether it's a mood-related disorder, a psychotic disorder, living with a substance-related disorder, anxiety or trauma-related disorder. But because they're involved in their recovery and they're involved in their treatment, that means that they could be seen as being healthy. So as we move forward, let's take a look now at the definition of mental health. Now, before I talk about this very in-depth definition that we have of mental health, one of the things that I really want to stress to each of you calling in today is the importance of us being able to talk about mental health. We know that there's a lot of stigma in our society when it comes to just the topic of mental health. But what's important for all of us to realize is that we all have mental health. When we look at that definition of health, mental health is part of health. We all have mental health, but we do not all have mental health problems. And that's where we need to see the difference between the two and realize that we need to be able to be having these conversations and checking in with our friends and our colleagues and our family members, not just about how they're doing physically, but how they're doing mentally as well. So when we take a look at the definition here, we see that, mental health affects the way that we feel, think, and act, that allow us our ability to enjoy life and to deal with challenges. We all have challenges in our life. All of us have experienced stressors in our life. I have yet to meet somebody who says to me they do not have any stress in their life. I would like to meet that person and find out what their secret is because, I myself and everybody and I know we all have different stressors in our life. And then, on top of that, the stressors that each of you in the professions that you've chosen in the death care industry, the additional stressors that come on for the jobs and the roles that you play in supporting grieving families and supporting people in their end of their life journeys. We know that having good mental health, solid mental health, provides us with a positive sense of that emotional and that spiritual well-being, that respects that importance of culture, that equity, the social justice, the interconnections and personal dignity. And we know that when these aspects are affected, when our culture is affected, when our personal dignity, when their social injustice is affected, that it can affect our mental health. But important going forward, knowing that we all have mental health and we need to be able to have those conversations around our mental health. Now, when we look at mental illness, this is often how society perceives mental illness, is that you're either healthy or you're not healthy, or you're ill or you're unwell. And this is, and also we know that stigma plays a role in that as well. But we know, and the evidence shows, and one of the things to point out is that our mental health first aid course, it is evidence-based, so we're able to show all of the resources and the references that come from how we put our program together. But when we take a look at truly how our mental health is, our mental health actually sits on a continuum. And so we can see where we go from green straight over to the red, but in between we have the yellow and we have the orange. And when we take a look at this, we take a look at, we could be going into work one day, and I realize that, some professions in the death care market may have regular business hours or banking business hours, as they call them. But all in all, that's not the hours that certainly a lot of you keep. And so we could be going in and being, feeling healthy and being, feeling on top of our game that day. But then we could have a stressor that happens. So think back to, whatever your role is in your job, your professional role. What are the stressors that you deal with work? So thinking about somebody who is an embalmer, for example. What if the hydraulic lift isn't working and you have a few cases you need to take care of? That could be a stressor. Or there was a situation, with the pickup of a deceased individual, that could create a stressor. But what happens is that when we see that in the reacting part, common and self-limiting distress is that. So let's say that a machinery is not working, or the room's not set up the way that's supposed to be, or maybe flowers haven't arrived as they're supposed to be on time. That could create some stress. But once that situation is remedied, so the hydraulic lift is now working, the flowers have arrived, the hearse has arrived on time. Now we're moving back into the healthy. So what's important for us to remember as we take a look at our own mental health is that our mental health can move from good to poor along a gradient on a daily basis. So those different stressors that you may contend with at work could cause you to be in that reacting phase. But what we really want to be mindful of is that if we're staying in that reacting and moving over into the injured, where we're starting to see more severe functional impairment, then we know that we need to get some help. We need to talk to somebody, because now we're in that injured phase. And what we want to do for our own mental health and for those in our lives is that we want to be able to seek some support so that we do not go into the red, or that if we're in the yellow and that we're staying in the yellow for a considerable amount of time, then we need to talk to somebody, because we want to make sure that we're staying more on that healthy end and providing that support for ourselves, and seeking that support that is out there to help us maintain some good mental health, but also being gentle on ourselves as well, and realizing that we all have stressors in our life, and that those stressors do affect our mental health, and we can be reacting, but having that insight that we're reacting, what do we need to do to move back into that healthy piece? And at the end of my presentation here, I am going to be talking about some self-care tips that will help you, hopefully, to when you see you're into that yellow, or maybe even moving into the orange, what are some of the things that we can step up for ourselves to get us back into the green and get us back into the healthy area. So next, I wanted to have an opportunity to talk to you about some common mental health problems. So like I said there at the beginning, anxiety and depression are the two most common mental health problems that exist. in our society today. And so the first one that I want to take a look at is depression. Now, one of the things I really want to stress to everybody today is that, we often hear people throw around the term depression, or people will say, oh, I'm so depressed. My team lost the Super Bowl because the Patriots are cheaters, and so I'm very depressed. I'm very depressed about that. But what we need to realize is that there is a big difference between being depressed and being sad. All of us in our lives at some point have experienced sadness, but not all of us have experienced depression. And we're going to take a look here at some of those signs and symptoms and where we can really see the difference between being sad and depressed and experiencing depression. So when we look at depression, it is the most common of all mood disorders. When we look at mood-related disorders, we're looking at that depression, bipolar disorder, seasonal affective disorder, postpartum depression. Those are all examples of mood-related disorders. Depression does affect 13% of Canadians at some point in their life. When we look at depression, so we see here that it's characterized by either a depressed mood or the loss of interest or enjoyment in nearly all activities for that period of 2 weeks or more, as well as additional symptoms. So what's important is that when we take a look at that difference between sadness and depression is that sadness doesn't last for that 2 weeks or more. With sadness, there could be an event that has happened. Maybe your best friend was supposed to be coming to visit you, or family was supposed to be coming to visit out of town, or maybe you yourself was supposed to go away and then something happened that interfered with your plans. You would be sad about that. But when we look at with depression, yes, we know that depression, when we look at risk factors, for example, and when we look at risk factors are things that happen, events that happen in a person's life that can put them more at risk or increase their vulnerability for developing a mental health problem. So when we take a look at, with the depression, we know that loss, for example, and when we look at loss, it's important to know that, loss just doesn't refer to loss of life. I mean, certainly I'm speaking to, to the professionals and the experts in the death care market today. You certainly understand the grieving and the loss because that's something that you deal with on a daily basis in your job. And, but we know that, with loss, it could be loss of job. It could be loss of a pet. It could be having to move from, one province to another. So you're leaving behind your support system, your friends, your family. That could be a loss, a breakup of a relationship. So we need to, we look at loss. And we also, when we take a look at loss, we have to understand from our perspective, it's not from our perspective, it's not from our perspective, it's what that loss meant to that person. So to us, we may think that, somebody losing a job, well, it's not a big deal, they're not a great employer, you weren't really happy with that job anyways, but it doesn't matter to that person that, that still was a loss to them. So it's what that loss means to that individual. And then we also see with depression is that depression is also recurrent. So that individuals will have episodes or bouts of depression. Whereas with sadness, we can be sad, but it's not gonna be recurring for us. When we also look at the recurrent part of depression, the statistics, the evidence shows that 70% of individuals who have experienced an episode of depression in their life will experience an episode of depression, will experience another episode of depression at some point. So when we look at signs and symptoms of depression, we see that it falls into four categories. So we have effects on emotion, effects on behavior, on thinking, and then those physical effects. So what I really want to stress to you when we take a look at signs and symptoms of depression, and first, before I get into that a little bit more, I just really want to clarify as well the difference between a sign and a symptom. So a sign is something that we will see. So we may see somebody that is crying. We may notice that somebody's withdrawing. So whether that's a colleague or a friend that is not having lunch or isn't going out, if you have some social events, they stop going out, being involved. Those effects on thinking, right? So with signs are things that we see, whereas with symptoms, that's what the person is feeling. So the person could be feeling anger, but we could also see that anger. the person could be feeling a lack of energy. There could be a lot of self-blame, a lot of pessimism, a lot of frequent self-criticism. So what we see with depression is that often a person will have a very negative attitude. So they may have a negative attitude about themselves, about where their life is going. They could be having a negative attitude about their job, just about in general, just negative attitude. And which can cause a person to feel hopeless and helpless. Excuse me. And so, but the one thing I really want to stress as well when we take a look at signs and symptoms is that not everybody experiences the same types of symptoms, the same types of signs and symptoms when it comes to depression. So we really want to be mindful of that, because we don't want to, say, oh, well, I had a friend and this is the way that he or she experienced depression, so you can't be depressed because you haven't lost your appetite. Well, for some people, it's an increase in appetite, where other individuals could be that they have lost their appetite. Excuse me. So we really want to be very mindful when we're talking to people, and have them explain to us about how they're feeling. The other thing we really want to be mindful of as well when we look at signs and symptoms, and one thing that I want to stress is that there's always a reason for change in behavior. So whether you think about yourself or you're thinking about a colleague or friends, family members, there's always a reason for change in behavior. And if we ignore that within ourselves and we ignore that with those in our life, we could be missing out on somebody who needs our support, or who needs to have that conversation with us. So I really want to be mindful, please, about, misinterpreting that somebody who is starting to be indecisive. Oh, they're just too picky. So, oh, nothing's ever good enough for them. Well, were they an indecisive person before? Is this something that's new? Is this a change in their behavior? Or somebody who is starting to withdraw or isolate. Oh, we're not good enough for them to go out with us now. Well, maybe maybe they just don't have the energy, and they used all their energy to come to work that day. Or somebody who is, has put on, has lost some weight. Oh, they must have been going on a diet. Well, maybe because of the fact that they're experiencing depression, they've lost that appetite. So we want to be mindful on, misinterpreting what those signs and symptoms may be. And truly, the only way that we can find out what's going on with somebody is by having that conversation with them. Now, when we take a look at depression in the workplace, what we see here is what that might look at in the workplace. So we see decreased productivity. There could be some morale problems. We take a look at absenteeism and presenteeism. Now, when we take a look at that, the difference is that with absenteeism, we know that a person is just not coming to work. Whereas with presenteeism, the person's showing up at work, but mentally they're just not. They're not there. They're not on the ball that day. So because of the fact that they may be struggling, with having some thinking difficulties, struggling with concentrating. That was one of the things that when I worked frontline, with clients that struggled with depression, giving some self-help reading material could be difficult because that lack of focus that a person could be experiencing. But when we take a look at that, where that lack of focus, then we know could, cause decreased productivity, could cause some safety problems. So taking a look at and thinking specifically, in your workplace and the role that you play and the role that your colleagues play, what might that look like for you in your organization, your company, business? What might a colleague look like if they are struggling? So what might that look like specifically within your, your work, your business place, and the specific roles that people play as well? So now we're going to move on here to anxiety. Now, the one thing I want to point out about anxiety in that first bullet point we see there is that anxiety is a normal feeling that we all experience. Every single one of us has felt anxious at some point. And often what people think is that when they hear that term anxiety, they think of just those negative things that happens in a person's life. So whether it's being involved in an accident, that certainly is a negative thing. But it's also positive events that happen. So somebody who's having their first baby, that could cause somebody to be very anxious. Going away on your first big trip out of the country, buying your first house, starting a new job, graduating university, Being a funeral director and it's the first family that you're supporting, those type of things, being an end of life doula and it's the first family that you're supporting. So we think about that anxiety that we experience that's normal for in those situations that's happening. Anxiety is also one of the most common mental health problems in Canada. And when we take a look at anxiety disorders versus that normal anxiety, so we see with anxiety disorders where it's more severe and intense, it's long lasting, so it interferes with that person's ability to function and occurs when a person isn't in a state of danger. So if we think about something that's more severe and intense, thinking about an individual, for example, that lives with panic disorder. And so that's one of the other things I just want to stress around language. I just reminded myself when I mentioned living with anxiety disorder. We really, when we talk about just the term mental health, how that in itself, brings on some stigma and people don't want to have those conversations. When we take a look at, the language that we use as well, we want to be mindful. We never want to identify somebody by their mental health problem so that a person is living with depression or a person is living with a panic disorder. So a person is not a schizophrenic, somebody is not a manic depressive. Language goes a long way, and we really want to be respectful. We want to be mindful that we do not identify somebody by their mental health problem because they are a person who is living with a mental health problem. They are not the mental health problem. So getting back to anxiety disorders versus normal anxiety. So with severe and intense, certainly living with panic disorder, that can be very intense where it certainly can interfere with the person's ability to even leave their home at times. Somebody who is struggling with or living with social anxiety disorder would prevent them from, going out, giving a presentation, asking somebody out on a date, putting their hand up and asking a question in class. Occurs when a person isn't in a state of danger. So, for example, that the panic disorder, in courses that I've taught over the years, I've had so many people, share with me their experiences of having a panic attack. I had one young lady, she woke up in the middle of the night having a panic attack. Another young person was getting ready to go out for the evening and just in the shower had a panic attack in the shower. So when we take a look, when it talks about occurs when a person isn't in a state of danger, what's the danger when we're sleeping? So we know that, with anxiety disorders, it is very treatable, but it's also that person seeking the help and the support to be able to work through and to be able to handle those distressing thoughts that a person may be experiencing, with that anxiety related disorder. But people, as we know, people can lead very good and happy and healthy lives living with mental health problems, but it truly is about finding the proper treatment and the proper support, because we know what works for one person doesn't necessarily work for another individual. And so moving forward, let's just take a look now at the different signs and symptoms of anxiety. So once again, as we pointed out, not everybody experiences the same types of signs and symptoms as well. Not everybody will experience the same intensity as the sign as other people do. And not everybody experiences all of the signs and symptoms that are associated with anxiety. So the first one that we take a look at is psychological. I'm not going to read this list to you. I'll let you do that. But we look at the psychological and we know it's a lot like, how are we thinking? So excessive inappropriate worry, that inability to concentrate, feeling detached, speeding, slowing of thoughts, easily distracted, irritability. And so we can see that, the psychologically, how it affects an individual. So thinking, for yourself, if you were experiencing anxiety, how might this interfere with you being able to do your job, right? So thinking about that, and we know that, if things are happening in our lives that's, being a barrier to us being able to do our jobs, then, we need to take a look at that. We need to take a look within and see, is there something going on? Then we take a look at the physical. So when we take a look at this, the physical signs, we can see that it reminds us of signs and symptoms of a heart attack. And especially when we take a look at panic attack, and panic disorder. Often when a person is having a panic attack, they will go to emerge because there's the feeling that they are experiencing a heart attack. So there's something I really would like to stress about the difference between panic attack and panic disorder as well. A person can have a panic attack in their lifetime, but that does not meet the criteria to be diagnosed with panic disorder. So panic disorder is when a person has repeated panic attacks. So I never want anybody, in whether in webinars or anybody that's attending any presentations or courses that has had a panic attack in their life to be concerned about having panic disorder. Panic disorder, to the criteria is that as a person has those repeated unexpected panic attacks. So we know, there is one of the most effective treatments out there when it comes to anxiety-related disorders is cognitive behavior therapy. And with cognitive behavior therapy, it provides, a person learns the skills to be able to take those anxiety-producing, those distressing thoughts and turn them into more positive and realistic thoughts. Because, we know I had my homeopath that told me at one point that our mind lies to us a lot. And certainly if we're struggling with anxiety and depression, our mind could be just, a lot of those negative thoughts, right? And that cognitive behavior therapy, we learn those skills to be able to take those distressing thoughts and turn them into more positive and realistic thoughts as well. So one of the things I wanted to add to this webinar pertaining specifically to all of you calling in today is around compassion fatigue. To be very honest, it's when it was brought to my attention that we were going to do a webinar for the death care market, I thought very interesting. Of course, I went online and to Dr. Google and did some research. I had an opportunity to speak with Olga, who's a end of life doula. So I've got some great insight from her as well. And just some of the articles that I was reading. But one thing that really jumped out a lot was that compassion fatigue. And so when we take a look at compassion fatigue, it's a state of exhaustion and dysfunction, results of prolonged exposure to compassion stress. It's also referred to, as the article I read, as an occupational hazard when it comes to the death care market. And when we look at the factors that lead to compassion fatigue, we're looking at long hours, unpredictable schedule, and emotional demand. And that was certainly something that a lot of the articles that I read about, especially with funeral directors, are those long hours, the imbalance between professional life and family life, and the time, limited time sometimes to spend with family, because as a funeral director, you're getting a call at 2:00 in the morning to go and pick up a deceased person. A coroner or medical examiner, same thing. You're being called to, scenes of horrific accidents, of crime scenes. Embalmers have their own emotional demand as well. End of life doulas, anybody, people working in the cemeteries as well. So, I learned a lot through reading articles as well. But certainly we can see that the emotional toll that working in the death care market can have on all of everybody in that profession. So when we take a look at the signs and symptoms of compassion fatigue, we see that chronic physical and emotional exhaustion, depersonalization, feelings of inequity. So, it talks about towards the therapeutic or caregiver relationship, but, caregiver has so many elements to being a caregiver. So for example, certainly end of life doula is being a caregiver. A funeral director, you're providing support to grieving families. So the demands that are put on you as a funeral director, you can understand, always being in that empathetic state. And so you may feel if somebody is struggling with some compassion fatigue, you may feel I've not given enough support to the family, or I didn't say the right thing, or when it comes to sorry about that. When it comes to an embalmer, for example, there could be the feeling that I didn't prepare the body well for the family. So those are the type of feelings of inequity that might be happening in the roles that you play. difficulty sleeping, weight loss, headaches. But when we take a look at this slide and we take a look at these signs and symptoms, we can see the similarities between compassion fatigue and depression. So we see where these signs and symptoms truly overlap. And so, I really want to stress to each of you is that if you're feeling this way, or if you notice this in a colleague or a friend or a family member, I would have to imagine that working in the field that you do, that you have those strong bonds with each other. So when you see those changes in behavior and you see some of these symptoms, it's about having that conversation, and it's about, having that opportunity to check in with that person and to check in with yourself as well. So I just wanted to put the difference up here between compassion fatigue and versus burnout. So as you can see with compassion fatigue, there's still that caring. You still want to do that job, but it's just maybe you just need to take a week off or 2 weeks, or maybe you need to take a month off and go sit on a beach in Mexico somewhere. That's what I'd be doing. You may over engagement, right? Physical damage. But when we move over, and so thinking about the mental health continuum, right? So we started off in the green with healthy, and then we're moving into the into the yellow where we're maybe reacting. Then we're moving into the orange a little bit, and then into the red. When I look at the comments here under burnout, where it says I don't care anymore, you require more than a break, loss of ideals and hope, disengagement. To me, a person who's experiencing that burnout is really kind of on the fence between the injured and between the ill. So we're actually between the orange and the red at this point. Compassion fatigue, to me, looking at that, would be you're around the yellow and the orange, where you're between the reacting and the injured. And that's where we want to make sure that if you're noticing that in yourself, where do you seek help? And there was one, certainly from the research that I did before the webinar, the lack of support that's out there. I know there's a support group in Ottawa. Read some great articles on that, but it's reaching out and finding out where that support could actually be. So mental health first aid training. So obviously everybody knows about physical first aid. Now I'm just going to touch just a little bit about mental health first aid, because I don't want to take away Alyssa's thunder here when I'm done, as she's going to be talking to you more about the different programs that we do offer here through us. But what is mental health first aid? And maybe prior to this call, some of you may have never heard about mental health first aid. But what it is that, I liken it to physical first aid. It's a 2-day course, a certified course, evidence-based course. But it's where people learn about mental health problems, and it's where participants learn about signs and symptoms, and that you're able to recognize if somebody's in a mental health crisis, whether they're maybe having thoughts of suicide or having a panic attack, and somebody who maybe is just starting to develop or starting to struggle with some early signs and symptoms. And what our course does is that through those 2 days, we teach you about those different signs and symptoms of various mental health problems. And then what we do is we talk about how can we be that support. So, what mental health first aid does not do is in 2 days, we cannot train you to be a therapist or a counselor, nor can we provide you with the skills to diagnose somebody within 2 days. One of the things that, I see sometimes when I teach the course is that, especially when we get into the anxiety and trauma related disorders, there's tends to be a lot more self-diagnosing that goes on. So, we don't provide you the skills to diagnose others, nor do we provide you the skills to diagnose yourself. So we can't teach you to be a therapist or counselor, but what we can provide you with is to, sharpen those skills that you come into the room with, and provide, some new skills and some new knowledge around mental health. Because truly about being a mental health first aider is that it's truly about being the best support that you possibly can be to somebody who may be struggling or living with a mental health problem. It's not about fixing the problem. We cannot fix the problem, but we certainly can support individuals in their journey as well. So in our mental health first aid, we use, as you know, with physical first aid, you have the ABCs. In mental health first aid, our 5 basic actions are ALGE. And this is how we teach participants how do we have that conversation. And so these are our 5 basic actions. I'm not going to get into them in detail at all. What I will tell you is that This is really a conversation guide. Is that what we talk about? Is that it's like we give you the guide about how to have that conversation. It doesn't start in this order. It's about, the important thing is that noticing when somebody is experiencing a sign or symptom or is having a change, and realizing that, once again, that, and I know I repeat myself, but it's important things I really hope that you take out of this today, is that there's always a reason for change in behavior. And if we can just, say, okay, I'm going to have this conversation, but it's not about fixing what's going on, but it's about finding out what's going on and how best can I support my friend, how best can I support my family member or my colleague. That's truly what being a mental health first aider is about. And all of us have the ability to do that. The one thing I really want to stress too, as well in mental health first aid, is the listening piece. So as we see here, talked about those 5 basic actions. And sorry, I went back one slide. I just wanted to stress that listening non-judgmentally piece and how important that is. So I really like this. I really like this quote. I use it often during, not just walking around using it, but during presentations. The most basic of all human needs is the need to understand and be understood. The best way to understand people is to listen to them. And I know that, every single one of us has very demanding lives, and, and it's not just the professional role that all of you are in that does take an emotional toll on you, but it is also the demands that you have on your personal life, whether it's family, whether it's children. Maybe you volunteer, maybe you have kids and you volunteer coach, volunteer at the school, what it may be, but all of the demands that pull you in so many different directions at time. But taking that opportunity to listen, to fully listen, and realize what the importance of listening really is. My colleague Alex is going to, in a minute here, show a video. I'd just like to introduce this video for you. This is a video that we use in our courses. It's a Brene Brown, and it's upon empathy. To me, it's very impactful. It's a short and sweet, but it really highlights the importance of being that empathetic person. It's not about sympathy. We don't want to have sympathy. We want to feel sorry for people. What we want to do with empathy is have the ability to see it from that person's perspective. So Alex, I'll hand it over to you to play the video now.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So that video, a lot of good points out of that. With us being able to be, empathetic. I really like the way that Brene says empathy is feeling with people. It's our ability to connect. And truly, the quote up there, the line up there on the slide right now, to be the listener you would want somebody to be for you. I trust that everybody here, when they're having a difficult day, and I believe that, you folks deal with your own amount of difficult days, that when you are talking to somebody that you really want them to be the listener. And I trust that, if we can be the listener for others the way that we would want somebody to listen to us, then we're doing the best job of being a good non-judgmental listener. So how many of you have felt like this on occasion or on more than occasion? Like I said earlier, I have yet to meet one person who does not experience any stress in their lives. And all of you, I'm sure, with the demands that you have on your role, on your jobs, may feel like this some days. This quote: "Self-care is a priority, a necessity, not a luxury in the work that we do." And I hope that you take a lot out of our presentations today. But the one thing is, if this is what you take out of this today, is about taking care of yourself more, and realize that it's not selfish and it's not a luxury. All of you work in very demanding roles, and you need to take care of yourself, because you cannot continue to take care of others if you haven't taken care of yourself first. So while I was doing some research for this today, I actually came across a YouTube video of a funeral director who listed her top 10 self-care ideas. So I thought I would share them with you today. So her first one was exercise. She had a video of her getting up at 5 a.m. in the morning while everybody else was asleep. 5 a.m., there's not many reasons to get up at 5 a.m. in my book, but good for you folks that do get up at 5 o'clock and go and exercise. She talked about sleep and having good sleep and naps. I know that some of you in your roles, your night is disrupted. So taking the time to have a nap. As kids, we probably all put up a fight about taking a nap, but as adults, there are days I'm sure we would be very happy to have an opportunity to take a power nap, I'll tell you. With eating, what she said about eating is that we all know about the benefits of healthy eating and making good choices. But she said too about treating yourself. You know what, if you want to have that brownie, for those of you that live in Ottawa, if you want to go to Susie Q and get a donut, whatever that may be, but treating yourselves well. Coffee. So not everybody's a coffee drinker. We realize that. But for her, coffee, she made it an event of comfort. So she had a coffee corner in her house. For those of you that are tea drinkers, I know all about David's tea. You could have pretty much any flavor these days. Have your tea corner. But something that makes it an event of comfort. Comfy shoes. I thought, that's something that I think sometimes we don't think about. It's not something I think about. Certainly as a facilitator it is. But some of you folks are on your feet for very, very long hours, having those comfy shoes. That decompress time, whatever that may be, laying in a hammock in the backyard where nobody's bothering you if you have that opportunity. Decompress time, for me, it's spending time with my dog. I see that BJ's on the call today. So BJ has a therapy dog. Oyo, spending time with Oyo is, to me, would be wonderful decompression time. So the grooming time for her, the AKA me time, mani-pedis, and I know men go for pedicures as well. But whatever that grooming may be, whether it's going to the spa for a weekend, getting a new hairdo, whatever it may be, but taking some of that me time. The educating. So for this funeral director, she listened to a lot of podcasts and she read books. She watched Bones. I have to say that Bones is one of my favorite shows. I still watch the repeats to these days. Family and friend time. We all know how important that is in our life. And the spiritual fill up. So whatever that is for you, but for her, that spiritual fill up. And so these are just how to restore yourself. And whatever it is for yourself, I challenge you today that to incorporate something new into your self-care routine. And if you don't have a self-care routine, I strongly, strongly encourage you to add some self-care to your life because you deserve it. And I think it's important for us to all realize that we deserve to take care of ourselves as well. So that I will say thank you. That is the end of my presentation. We will have a Q&A at the end. I thank you for listening.
Thank you, Denise, for your informative presentation. We're just loading up my presentation at the moment, and I want to thank everyone for listening in to our webinar so far. My name is Alyssa Blett, and I'm the Business Development Officer for the Mental Health Commission of Canada. So today I want to talk to you about the importance of mental health training, what we offer, and some of the benefits of taking our training. At the Mental Health Commission, we provide training to empower people to care for themselves and others by developing the skills to look after their own and others' well-being. I think we all know what a positive well-being is good, that a positive well-being is good for business, and that healthy people are happier, they're more engaged, and they're more productive at their jobs. By teaching practical mental health awareness skills, we can create a safe and healthy workplace where the mental health and physical health of employees are valued equally. Our training can minimize the impact of mental ill health on work and life. Oh. I am so sorry. My slides just did a 10 forward. So our training can minimize the impact of mental ill health on work and life, and it gives people the tools to keep themselves healthy and support one another. As you can see from this slide, the economic cost of mental health problems in Canada has reached $51 billion annually and will just keep rising. When you create a mentally healthy workplace, the benefits are enormous. Your employees will be happy, they'll be motivated, and they're going to work more efficiently. You'll also save costs due to less absenteeism and disability. You'll have fewer grievances and a stronger corporate reputation. In turn, you're also going to receive better quality candidates as they look for a workplace that is a leader in workplace wellness. I find our training is pretty special. Our courses are written by experts, they're grounded in research, and it's also tested by people with lived experience of mental ill health. When you take our training, you will be joining a global community of over 3 million people around the world who have trained in mental health training skills. In Canada, we have trained over 400,000 people in mental health first aid and over 180,000 people in the working mind. All of our courses are delivered by a qualified instructor who has completed our instructor training program. We are the only provider of licensed mental health first aid and the working mind training in Canada. Our courses educate people about general mental health. This helps to open up conversations, break down the stigma, and encourages mental health resiliency. It can also help people become more aware of how to access help. So this allows for quicker recovery times and also more positive outcomes. Just so you know, all of our courses are delivered face-to-face by an experienced associate instructor. And all of our instructors have been recruited due to their diverse backgrounds, their experience in mental health, and their ability to engage and motivate participants. And of course, everyone who completes a course gets a certificate of attendance. So what do we offer? At the Commission, we have two programs that are similar in that they are both mental health training. However, they are quite different in their content and objectives. We have mental health first aid and the working mind. Both of them are complementary in that they address different perspectives of mental health. However, mental health first aid is other-focused, where you learn the skills to interact with and help others experiencing a mental health problem or crises. Whereas the working mind is self-focused, where you learn to reduce stigma surrounding mental health, including self-stigma. So we already know a bit about mental health first aid training from Denise. And this course teaches people to spot the signs of mental health issues, and it can offer initial help and guide a person towards support. Please understand that we do not teach people to be therapists. We really teach people how to listen, how to reassure and respond, even in a crisis. And also even potentially reach out to someone before a crisis happens. As a mental health first aider, you will gain many skills and the confidence to engage someone with an emerging mental health problem, or someone who's also in a mental health crisis. You will learn to recognize mental health problems, and you use that knowledge to help someone recover by guiding them to further supports, like self-help resources, employee assistance programs, or even external resources like a doctor or a psychologist. So as Denise mentioned, we have several varieties of mental health first aid, but the one that we are sharing with you today is the Mental Health First Aid Basic Course, which is a 12-hour course taken over 2 days. Some of the course sections include substance-related disorders, mood-related disorders, psychotic disorders, and anxiety and trauma-related disorders. Becoming a mental health first aider can really help you recognize the signs that a person may be developing a mental health problem or experiencing a mental health crisis. So now let's talk about our other training program, the Working Mind. The Working Mind is an evidence-based program designed to address and promote mental health, and it also reduces the stigma of mental illness in a workplace setting. With this training, you learn how to recognize changes in behavior that could indicate a mental health issue, either in yourself or in others. You also learn several coping strategies and lots of resiliency skills as well. This training is really aimed to reduce the stigma of mental illness, as well as to promote mental well-being in your organization. It helps people identify poor mental health in themselves and others, and teaches coping skills to manage stress. We also provide a lot of tools and resources to support employees who may be experiencing a mental illness. And this program, The Working Mind, assists supervisors in maintaining their own mental health, as well as promoting a positive environment in their organization. So the Working Mind offers a 4-hour training for employees and an 8-hour training for managers. But the difference between the employee and manager training in the additional 4 hours is the managers learn workplace accommodation, things like how to create a positive, supportive atmosphere and how to also take care of themselves. The participants are provided with valuable information specific to stigma and barriers of care. The Working Mind also teaches a set of tools called the Big Four. And as Denise explained in the previous presentation, the mental health continuum model. So what is the Big Four? The Big Four refers to a set of skills, practical skills, and its purpose is to provide people with some tools to help deal with and manage the stressors one encounters on a daily basis. These tools not only increase your ability to bounce back from stress, but also help you thrive under pressure. And as you can see, I am sure that we're familiar with most of these skills: goal setting, visualization, self-talk, and a big one for me is deep breathing. As mentioned, we also use a self-assessment tool with indicators of positive, poor, and declining mental health. I find it provides a common language that everyone can use to describe how they are feeling that day. With this model, it eliminates the need for stigmatizing labels by using colors. And as mentioned before, each phase provides signs and indicators for self-assessment. So, although many organizations are keen to have our experienced mental health instructors deliver our courses, some decide to train a member of staff to become an in-house mental health first aider or the Working Mind instructor. Once qualified, they can deliver the courses whenever they like. Our 5-day instructor training program gives future instructors all the tools needed to deliver successful mental health training. All of our courses include scenario-based practical applications and custom videos of people with lived experience of mental illness. We also include participant reference guides and related handouts. So to summarize, our training can build employees' confidence by openly discussing mental health issues and encourage people to get help when they need it. When we are open about mental health, we empower people to thrive. Our training also increases resiliency skills and creates a supportive, mentally healthy environment. And when we recognize our own mental unwellness, we can take the necessary steps to get help and support. And so that concludes my brief presentation on our training programs at the Mental Health Commission of Canada. And so now we're going to open it up for questions.
I just wanted to jump in. I had a couple people thank us for the really like the empathy video. It's actually on YouTube if you're looking for it. We obviously, as a national program, did need to receive consent from RSA Shorts to show the video, to have the video in our courses. But they were very quick to give us consent for that. But you can find it. Just go Brene Brown Empathy, and you will find it on YouTube.
Hi, Jennifer. Do you want to ask a question?
Somebody asked up here about how they can access the training mentioned. So for mental health first aid courses, you can go to our website, which is just mhfa.ca or mentalhealthfirstaid.ca. Either way you put it in, it's going to come there. And when you go to our website, you can on the front, it will say find a course or find an instructor course on the home page of our website. We have it broken down according to city, so you should be able, our instructors do for the mental health first aid courses do post the courses online, whether they're public or private courses, so you would be able to find a course within your area. Alyssa, could you talk about the, not sure about the mental health, the Working Mind training?
Working Mind? So the Working Mind, it's very similar.
So if you click on that, the workingmind.ca, you would be able to access that information through there. And Alyssa also added the MHFA link as well for you folks. So, Alyssa, seeing that it's 2 o'clock and we've taken an hour of your time, so for myself, I just want to say thank you very much for your time. And I hope that this was informative and you've taken some good points out of this. And if there's anything else, please feel free to follow up with us via email. We are always happy to answer any questions that you may have around any of the programs that we do offer. Alyssa, I know if you want to check out, but yes, everybody just have a good rest of your day and enjoy your long.
Thank you everyone for joining us today. We really appreciate it. If you do, as Denise mentioned, have any more questions, please feel free to email us and we can send you resources via your email. And again, thank you for listening in.